Next laser are IPL, a Lume 1 intense pulsed light. This is a targeted light therapy. Its primary purpose is for brown and red. Brown and red can be any number of things. That could be sun damage from the person who was the sun worshiper all their life, or they had a vocation outside that necessitated on the face, the chest, the arms. These are the most common areas of treating sun damage. Hyperpigmentation. Frequently see a condition called melasma after childbirth. It's very much discoloration, tends to be in the face, almost looks like a mask in women after childbirth. These are common types of pigment that we treat with the light. What it is doing, it is targeting, again, it is not a deep ablative laser. However, we have the capability of filtering to that layer of the skin in the tissue that we want to target, because we know pigment sits in a number of layers in the skin. So just targeting one specific layer is typically not going to remedy the problem that you're here for. Again, a treatment plan is developed when we're looking at sun damage or looking at hyperpigmentation, any kind of discoloration that has brown in it, taking into consideration the skin type, the skin color, ethnicity. Lasers are not selective on what pigment you're targeting. So when you're targeting a hyperpigmented person with very fair skin, it's a very different setting than hyperpigmentation in darker skin. Because the darker the surrounding skin is, you have to be very conservative and treat, you want to target the problem. You don't want to target the entire area. So again, is one treatment a magic bullet? Typically not. A lot of times in small, isolated, pigmented areas or problem areas, you can achieve that with one treatment. But again, looking at, you're here, I use sun damage because that is the most common reason for people to seek laser therapies. Even in that population, they are faithful about their skin care. They use micropeels. They do all the right things. They now are a convert to using sunscreen daily. Sun damage is a result of years and years of assault on that tissue. It just finally catches up with you. And there's only one good way when you're using these lasers is typically a series of treatments. You're breaking up that pigment in whatever layer of tissue it's sitting in. And essentially, the body is absorbing it, getting rid of it. So again, the nice thing with these lasers, really no downtime. Sunscreen is paramount to prevent further sunburn, but also you don't want to be counterproductive. You're erasing the sun damage only to go out in the sun and get more. Now, we're not saying that you can't ever walk out in the sun again. But the days of lying out with baby oil and iodine are no longer. And that is going to catch up with you. And it makes it more difficult the longer you have that kind of exposure over your lifetime. You start working on improving the health of your skin. Now, these lasers are not intended for use in those suspicious types of pigment or moles that may be cancerous. We're very strict on that evaluation initially before any therapy is delivered, and that if something does appear suspicious, we refer these patients to the appropriate physician, have that evaluated and taken care of. So there's a very, kind of a broad guideline that we have of conditions that we can treat, but anything beyond that normal, we're going to refer. The other type of pigment that IPL is wonderful for is red in general. Again, it's looking for that oxyhemoglobin in that tissue, and that's what it's going to target. So settings are a little bit different for someone that their primary problem is red versus brown. Now, a lot of patients walking through our doors have a combination problem, and we are going to treat it separately, but in a combined setting. We want to target the worst part first. Is it brown or is it red? Classic red situation would be rosacea. Have a lot of patients that have battled a number of years, usually unsuccessfully, on controlling rosacea, and there's a number of things out there that are being used that can help. IPL is a tool in really looking at the whole problem. It's a chronic problem. It's not a problem you can correct today and it's going to stay away the rest of your life. Rosacea is one of those conditions that has multifactorial reasons of why some people look more red than others. It's not just superficial blood vessels that make the face appear red on the cheeks and the chin, the nose, but triggers of heat, drinking alcohol, working out. All these things have a bearing on that, and so some things you can control for, others you can't. We live in Florida. You can't necessarily stay in an air conditioning setting all the time. You're going to be outside. But by using the laser to really knock down those vessels, knock down that red, using these other combination treatments of, the skin care that's targeting that as well. Maintenance with those types of skin products that are going to keep it at bay. Again, it's key. These lasers, we think of them as corrective, which that's probably their primary work, is you've come to us with a problem. You want to get it corrected. So we develop that plan to correct it. But it's just as important, if not more important, of what are you doing otherwise for your skin in that area that you have that problem that will help maintain this correction. So maintenance is key, and combination therapy is key for the best result.